Breast augmentation is a procedure used to enhance the size of the breast. The most important thing you must consider when you're thinking about breast augmentation is that you must consider the implanted machine. The two main companies that produce the implants warranty the implants for 10 years. So you expect that implant to last that amount of time. Most patients in a lifetime will have to have a second surgery to replace the implant due to either implant rupture or scar tissue formation around the implant. So I think it's an important consideration before you think about breast augmentation. There are two types of implants available in the United States today: the saline-filled implant and the silicone gel-filled implant. The silicone gel-filled implant was the implant was taken off the market in 1990. That's been back on the market about 7 to 8 years. The advantage of the silicone gel implant is that it's softer. It's more natural. When you use this implant, it's more like your own tissue. It's more difficult to tell where the implant starts and stops. The saline implant is the implant that's been available in the United States from the 90s. The advantage of the saline implant is there's no problem. There's nothing connected. There's no problems connected with saline. If a saline implant ruptures, it's salt water. It's the same thing as IV fluid. So there's no question that it could cause any problems. With the augmentation, most times what we're doing in the United States is we're placing the implant behind the muscle. The advantage of placing the implant behind the muscle is that more of your own tissue is on top of the implant, making the implant feel softer and more natural. Also some evidence that you have less scar tissue formation when the implant's behind the muscle. So far as the surgery can be done through different incisions, different routes. One of the more common routes is the inframammary incision. That's an incision placed below the breast. The periareolar incision is an incision placed around the nipple. And then sometimes the axillary incision can be used. The recovery from the augmentation is not very severe. Most patients feel problems with the anesthesia the first night, nausea, vomiting, woozy feeling from the anesthesia, throbby, aching feeling from the surgery. Usually not severe pain. Within the next 48 to 72 hours, most patients are feeling much better. Within 4 to 5 days, most people are finished with their pain medicine and needing narcotics for their pain medicine. It takes approximately 2 to 3 months for the full recovery from the augmentation, where you will have swelling, and initially the breast will be high. As the swelling goes down, the implants will come back down to their normal position. It takes, again, about 3 months to get the final look after the augmentation is done. Some of the complications you have to consider with a breast augmentation. You have to consider the complication of implant rupture. You have to consider the complication of capsular contracture, which is scar tissue that forms around the implant. Whenever silicone's in the body reacts to silicone and make an envelope around that silicone. Normally that envelope is thin and soft, and that's normal. If the envelope becomes hard and thick, that's called a capsular contracture. That could lead to having to go back to surgery to remove that scar tissue and exchange the implant. The other complications you have to consider is a decreased nipple sensation. Sometimes after the augmentation, the sensation nipple may be decreased. It's very rare, but that's a possibility. So far as breast cancer, there is no increase or decrease or change in the risk of breast cancer with the augmentations in place. The last thing you must consider is infection. Infection around an implant can be severe and can be difficult to treat because the implant will act as a foreign body holding onto that infection. If that happens, sometimes you may have to go back to the surgery, take out the implant, leave it out while the infection is being treated, and come back and put the implant back in. Those are the things, the complications you have to consider with a breast augmentation. The augmentation is a straightforward procedure. The operating room times can range between 30 minutes and 1 hour to 1.5 hours, depending on the surgeon and depending on the type of augmentation things being done. But usually it is a straightforward procedure with a low amount of stress on the body. Most times the surgery is done with general anesthesia, although some people do it with local anesthesia with sedation. It is, as surgeries go, it is a lower risk type of surgery in the sense that it's not one that is a prolonged surgery and it doesn't stress the body. Breast augmentation is one of the popular surgeries in the United States, and the silicone implants becoming used more widely. Thank you very much.